I can't think of anything more important to spend your life working on than improving the lives for children and families in South Carolina. This group of people is outstanding. The movement is called home visiting for a reason. And that means they're getting out into communities, into homes, working directly with children and families. I mean, what a calling.
Well, since 2010, we've been working in the world of home visitation and bringing home visitation across the state with the idea that not one program fits everybody. And our intention is to be able to create a continuum of home visiting services in every county so that the families can get the program that meets their needs, not just the one that we happen to have.
Home visiting is critical for certain subsets of the population we serve. And obviously, much of our focus on it in the past couple of years has been for early childhood and making sure that we find models that have a good evidence base and that can be operated with fidelity by practitioners who are qualified and experienced.
Health is produced in where people live, work, play, and learn. So having an intervention like home visiting, where it goes actually into that just daily life experience space, is teaching us profound things about what it's going to take to really improve child well-being.
The most important thing is really seeing these families strive and become self-sufficient. We want children to grow, to be healthy. We know that these are the most important parts of a children's life. They're predictors of some very important things later on in life. It's not just Children's Trust making this happen, that our local initiatives are really working hard as well.
I think the secret to building our state and building our 0 to 4 years of age and getting them ready for school is that all come together, mesh their knowledge, their statistics, and their plan, and we need to listen to each other and move forward. If everybody's out there doing their own thing and nobody knows what the other's doing, it will not be a successful program.
A home visit provides information, it provides education, it provides different types of support, but it's a social connection opportunity. It's not a special visit, it's not a special place. This is in your daily life. And I think something magical happens when that is the level of interaction and support that really can help families.
When we started this 5 years ago, we barely had 100 people at the conference, and nobody was really sure whether they should come. Is their model going to be talked about, and how could we possibly bring everybody together, and what would we do that would be useful to them? And now here we are, over 300 people. We had a waiting list for people coming, and they understand the idea of sharing best practices, the rejuvenation that they get from each other. No matter what model they're working on, they're doing the same thing in different ways for different families. And by coming together, they see that we're all working towards the common purpose of meeting families where they are and giving them the services that they need at that time.